So she looks really good. She's barely bruised. Right?
Beautiful.
Yeah, we're gonna take some of this cotton off, clean her up. So she has an incision under her chin, which looks really clean. Even here, everything looks really clean. She has a drain here. This is an open drain. It helps facilitate the drainage after the surgery. I'm just gonna gently pull this off. And then let's take a look at this side. It's looking really, really good. A little lumpy, usually from some drainage. All these lumps and bumps are all normal. It's from pulling the skin back. It's gonna take some time to heal.
You can see the drain right there.
Yeah, so you can, so it collects the fluid. Okay, so it just facilitates a little bit of the, it helps them a little bit of the drainage. This is just some saline. Sometimes we add a little bit of hydrogen peroxide if the patient's really, if there's a lot of crust from the blood, the dried blood, but she's actually looking pretty good. Yeah, so we're just gonna take some saline and kind of gently wash everything off for her. And she can shower today when she gets home. She just has to be really gentle.
No bending over her hair.
Just be really gentle, like use very gentle cleanser, and like you see how I'm gently kind of just washing and patting at this dried blood. And you take a thin layer, okay, using a clean Q-tip, and just do a thin layer, see here, over the incision. So she has this incision in front of the ear, okay, and then behind the ear. Take a little trip here to see. Turn your head away from me. Good. So right here, incision behind the ear. And it actually kind of loops around to her hairline a little bit. I don't know if you can see. You see that?
It's fine. It's
Yep.
fine. Yeah.
And then just want to make sure you're getting it all here. So right there. And then you just want to use a new thin layer. Right? And then same thing on the other side. So just turn towards me. New Q-tip. She has a little bit of drainage here, that's okay. Clean that up for her. And then we just get her, okay? And the Aquaphor acts as a barrier. And we're gonna put this on top of the antibiotic ointment that we just put on her and her incision. So this will really, really protect her incisions, okay? It's also gonna seal in the antibiotic ointment that we put in. Also, you can be very generous with this ointment. You'll see why, because it actually acts as a glue. When we put the gauze over the incision, it's gonna help it stick, okay? Behind the ear.
That's the gauze. That's the 4x4. That's the gauze.
And you fold it in half.
Fold it in half. Okay.
The folded side is going to go towards the incision.
Okay.
Meaning that this one is going to go like this.
Right. Yeah.
And the one behind her ear is going to go like that.
Right.
So it kind of forms like a butterfly. And the Aquaphor does a really good job acting as a glue, helping it stick like that.
Okay.
Right? You're going to fold it in half. Folded side goes towards incision. Kind of tuck it in there. So that protects, right? Now it's protecting the area.
Okay. I got it.
And very important, you're going to be using this wrap for the next week.
Oh,
Okay?
the same-
You can take it off to eat. You can take it off to shower. After you're done eating, you want to wear this as much as possible.
Right.
And definitely while you're sleeping.
And
Because it's going to help compress this entire area, which is going to help prevent any excess bleeding, drainage that's going to accumulate overnight or like, you know, throughout the day. And, you know, she's going to be getting up, you know, like when you walk around a lot throughout the day, your legs get swollen. It's going to be the same thing for her face. You don't want all that fluid to kind of accumulate, and then it's just going to be, the healing process is gonna take a lot longer. So you really want to compress this, not too tight,
Not too tight,
but
tight.
enough to kind of have something there to support this entire area.
Right.
Second most important wrap, make sure you're not applying it like this, perpendicular to her skin. You see that?
Yep.
So it's not cutting her skin, kind of more like a
That's at the base
turtleneck.
of her neck, yeah.
And then you want to make sure the wrap is always covering the area at all times. And I'm gonna adjust it, you know,